we came to this clinica, and this clinica helped us, the pharmacist and my doctor, Dr. Banfield, helped me, and I listened to them. This clinica put me in a good shape, and I'm healthy, and thanks to them for the rest of my life, how much longer I will be.
On a national level, the collaborative has seen results in population health, in patient safety, and the capacity of our community teams to build integrated systems. And we've even seen our teams able to show the cost benefit to these services. They're able to bend that curve so that patients have more access to clinical pharmacy services.
If we look at the medical home model, we try to do everything in one place for a patient. If you incorporate pharmacists into this medical home concept, patients can get better drug information, better education about their medications. They can get medications at a cost-effective price that will save them money.
The health home concept is something that I am a big supporter of. We talk medical home at many of the assemblies and seminars that we have in Wichita. We think it's the wave of the future as far as delivering good quality care to people, not only medical care, but preventative care. You know, any kind of relationship with a doctor or a provider is going to give you better outcomes and better wellness than the system we have today.
They talk to you. They teach you. They want you to learn. They want you to be part of the choices.
And what kind of reaction do you have to those medications?
The sulfa is definitely the itching and the big heart. Keeping these diabetic symptoms away so that I don't have a lot of neuropathy and I don't have the beginning of the blindness. And I don't have this. If I don't have it now, the longer we wait, the longer we can keep it from even showing up at all, the better off we are and the longer a life I'm going to have. I never thought I'd live to 60. I never, ever, ever thought I'd live to be 60 because my mother died at 58. And I had no role model for living to be over that.
The primary goal is to make sure we get the best care to the patients, not the worst. These are patients who are typically uninsured, isolated, and medically vulnerable. And they should have the very best, and we can do that by supporting the delivery teams with tested interventions, the best science, and accurate consumer information.
I'm a poverty patient, I'm a medical assistance patient, and I've got the best doctor I ever had.
Things can be done to help people who are not meeting their goals. In part of the learning sessions that we've gone to, there's been a lot of focus on patient-centered care. This information has been brought back to our providers and shared with them in ways and methods to reach out to our patients that haven't budged in a couple years, that they're not obtaining their goals. By using some of the elements we've learned from the learning sessions, we're able to get people to goal. It's a greater sharing of knowledge that we wouldn't have otherwise that has helped this occur.
I have been diagnosed as a type 2 diabetic. And my blood sugar reading when I started at the Siouxland Community Health Center here, it was at 650. Had I not taken their advice and their medication and listened to them taking my blood readings, I wouldn't have been able to speak about my health as it has improved.
The FDA Office of Women's Health is providing PSPC teams with patient education materials at appropriate literacy levels, not just in English, but also in Spanish, in Asian languages, and in a few other languages that are culturally appropriate.
I think PSPC is a key to improving patient care. It should really be spread to all the clinics in the U.S. because it just makes people aware of all the things that could go wrong and things that we want to avoid at all costs, especially now that we have so many diverse patients that maybe don't speak the language, that maybe don't have the same education. to understand a lot of the complex diseases that they have. And this just makes the staff, the providers aware of things that could go wrong. And we want to get there before they happen, prevent and give the best patient care we could ever give.
So now holding back a 2 milligram, it's like right where it should be, so.
Okay, so we'll keep you on that dose, and we'll have you come back next week.
Pharmacists can be at the forefront in decreasing these barriers, increasing access to care. As pharmacists, we find great joy in helping patients out. We like to see a smile on their face. We like to see good outcomes come from the work that we have done together with them.
And I feel healthy. I feel energetic that I never used to be before.
People get rewards when they stay well. Rewards of feeling better than they have in years, or whatever it is, that you finally comply with something and you go, oh my, I didn't know I could feel that decent. This is what it will be. They will be like, clinics will be like this.